The Department of Health's logistics and technical expert Rob Buerter says the fact that the first batch of vaccines doesn't have a barcode is not a matter of concern, at least not for now.
Understanding that this first batch is literally that. There's only one batch, so there aren't multiple batches, and there's only one product in the country at this particular point in time. So for now, without the barcode, which wouldn't have solved that problem, there is only one that is available now. As I said, the security around it links to storage, it links to the transporting and the security associated with that. So there are measures that are being put in place around the physical security of it. As I say, a barcode on a product doesn't prevent theft. What it does do is it enables you to identify it.
Well, health authorities do not seem to be concerned about the tracking of the vaccine doses throughout the country, but others are raising a red flag. For more insight on how the process should work and what should be done to protect the vaccine, that is, we're joined by contributors to the Bhekisia Centre for Health Journalism, Adele Sulcas and Darren Taylor. Good evening to both of you, and thank you so much for your time. Firstly, let's just begin with the issue of, what needs to happen to this vaccine to ensure that its integrity is not compromised between now and the point that it reaches these distribution centres in provinces. Adele, let me begin with you.
So as Rob Buerter was just saying, the real risk is around making sure that the vaccine remains in good condition. The cold storage chain is very sophisticated and very secure. The vaccines in the pallets in which they traveled by air from India have been packed in very temperature controlled boxes with temperature logging devices in the boxes that record a history of the temperature that the vaccines have been at the entire journey. And that continues once they have arrived as of this afternoon in South Africa. So when the vaccines, after clearing customs today, get to their warehouse facility in Johannesburg, the boxes will be opened there and those temperature logs will be checked. The vaccines will remain in cold storage in the warehouses while a small sample of those travel by truck, temperature controlled, to Bloemfontein, again in temperature controlled boxes or boxes that have some form of ice packing in them. And they will get to the National Control Laboratory in Bloemfontein where the samples will be tested. And in the meantime, the majority of the vaccines will remain in that cold storage warehouse in Johannesburg, quarantined, which simply means kept in good condition, secure, and at the right temperature.
Darren, let me bring you in here. One of the big questions that many South Africans are asking is around potential criminality where these vaccines are concerned. And should people worry that they don't have barcodes right now? Is it going to matter once they're distributed to different provinces if they have barcodes or not? Does it even matter?
No, not right now, Kathy, because I think Rob gave a pretty good explanation over there that barcodes don't prevent theft. However, what barcodes do prevent, if you have the correct system, is they do prevent falsified vaccines from slipping into the system. Sometimes they do. A lot of the times they do. Let me just explain. The health department will be using what's called an electronic verification data system. And the way they explain to me, it'll be a good system if it works like they say it will work. But its name says it all. It's a verification system. It's not a security system. So under the EVDS, the person who wants the vaccine registers on the platform via cell phone. The EVDS captures relevant details, full name, ID number, etc. Then when you get to the vaccination site, the officials who will give you the shot record the type of vaccination they've given you, where it was given, time, batch number, etc. And obviously if you had an adverse reaction. Yes, this does offer a measure of security, Kathy, and also patient safety. but it doesn't offer full track and trace capability to safeguard vaccines. That, in fact, is offered by a system developed by an international firm called GS1. This is a firm that is endorsed by the World Health Organization and the World Customs Union to protect vaccines by means of what's called data matrix barcodes. When you scan such a barcode, if you've signed up to the GS1 system, that links to an international database, and that will throw up red flags if there's been a problem somewhere in the world with a particular medicine or vaccine in this case. If there have been recent problems with falsified vaccines emanating from a particular source, for example, the red flag will go up and the healthcare worker on the other side can exercise due care. So the GS1 system allows eyes to be on these vaccines right through across the supply chain. And in a nutshell, the EVDS tracks. It's largely a reactionary system, whereas the GS1 technology tracks and traces medicines forwards and backwards and is largely a preventative system. Kathy.
Darren, it's an interesting point that you're raising about the technology that's available internationally to try and track these vaccines. But there have also been warnings from some experts about South Africa trying too much too soon in terms of new systems that we haven't used yet, and our ability to actually bring them on board and use them effectively during this campaign of vaccination.
Definitely. Well, I'm not really worried so far from what I've seen about the National Health Department. All the sources that I've spoken to over there, and including Rob, I've come to know them as pretty competent people. I am, however, concerned from what I'm hearing from sources across the provinces and nationally about the provinces themselves. They haven't exactly so far inspired a lot of confidence, some of them. And we must also remember that eventually, once we become used to receiving vaccines, there aren't going to be cavalcades of black BMWs following them. We are going to be used to this, and that is when cards are going to drop, and it's going to end up in the hands of some of the very people who previously in our history have stolen medicines. Now, some of these doctors and nurses at public hospitals especially have in the past stolen medicines to order for criminal networks to then distribute the medicines. So that's also something that we really have to be careful about. As much as I don't like saying anything bad about our healthcare workers at this stage, what I've just stated to you is fact.
Darren, you know, we always trust for the best, but you've just reminded us of just how terribly things can go wrong. And if our history is anything to go by, there'll be many South Africans who are anxious about those possibilities. Adele, let me wrap it up with you and talk about the registration processes for people who want to get vaccinated. Is that website already live, up and running? You know, what do people need to know about that process?
So the website is not yet live. And in fact, the National Department of Health has not announced exactly when it will go live. However, they have said that this will be communicated via social media, via unions, possibly via places of work, specifically for healthcare workers who are targeted in phase 1. And the way it's going to work is that through a web portal or an app, if you have a smartphone, you can use an app to do this. Each person who would like to get vaccinated will register on the EVDS. This will capture their ID number, whether they are in a medical aid scheme or not. And after the registration process is completed, the person who is registered will receive via text notification of an appointment time, date, and a location. For healthcare workers, this is most likely to be their place of work because hospitals will be part of the network of vaccine centers. And then they will need to present themselves with the registration information that they've received back via text, which includes a vaccination code. And that's it, they'll get the jab in their arm. And after the first dose, they will receive another notification confirming that they've had the first dose and registering them for an appointment for the second dose 12 weeks later.
All right, let's leave it there for tonight. Thank you for your time. Adele Sulcas and Darren Taylor, who are both contributors to the Bhekisia Centre for Health Journalism.